My name is Dr. Stephen Borgian, and I'm a urologic oncologist in the Department of Urology at the Mayo Clinic. One of the areas of my research and clinical interest is optimal outcomes for men with high-risk prostate cancers. We recently conducted a study looking at how men with high-risk prostate cancers are treated, comparing the effects of surgery and radiation therapy. It's long been thought in the academic community that men with high-risk prostate cancer shouldn't undergo surgery because surgery is not associated with long-term cancer control. In order to evaluate this, we looked at our experience with radical prostatectomy and lymph node dissection for patients with high-risk prostate cancer. High-risk prostate cancer is defined as men with a PSA greater than 20, a biopsy Gleason score of 8 to 10, or a clinical stage of T3 or greater. We had over 1,200 patients in our institutional experience that underwent surgery for high-risk prostate cancer, and what we found was that at 10 years, the cancer-specific survival for men treated with surgery for high-risk prostate cancer was 92%, and that in fact, when we controlled for characteristics of the disease as well as patient comorbidity status, patients treated with radiation were significantly more likely to die than patients treated with surgery, suggesting to us that surgery is associated with excellent long-term cancer control even for those patients with aggressive or high-risk prostate cancer. The other advantages that we believe surgery affords patients with high-risk tumors is the opportunity to obtain accurate pathologic staging and therefore guide the judicious application of secondary treatments like radiation or hormones, as well as excellent long-term local cancer control. For these reasons, we believe that men with high-risk prostate cancer should be considered candidates for surgical intervention in the form of radical prostatectomy and lymph node dissection. We have at the Mayo Clinic one of the unique opportunities to evaluate patients like this because of our research database and support. We have a database of over 14,000 men with prostate cancer that have been followed for over 25 years. Working at the Mayo Clinic allows us to evaluate long-term outcomes following treatment in these patients and be able to provide recommendations and suggestions to improve patient care going forward.